Hey, what's up? My name is Clayton J, and today's topic is about my top surgery consultation. I had my top surgery consultation on Monday, and today is now Wednesday, so it happened 2 days ago. And I'm just going to tell you a little bit about it. This is my first top surgery consultation, and the thing here in Iowa, we don't have a big variety of surgeons. There's not that big LGBT, like, Iowa's not an LGBT place, so there's not that much transgender people that like reassignment surgery places. There was 3 that we searched up. This one's the closest one, an hour away in Des Moines, and we called the other 2 places. They retired. So this guy needs to work. I have to go with him. There's no, even if I hate him, they have to go with him. That was in my mind. I was like, okay, well, even if I hate him, I have to do him, or else I have to go to a different state. I think other people do the surgeries. He's just like, I searched up like transgender, not just like, because it's called breast reduction, but I don't want like a female one, or I don't want like someone to like. You understand, like, I want someone that knows about transgenders. I want someone that, like, it's not like, oh, okay, breast reduction. That just means take a breast, make it smaller. No, I want it to be masculine as hell. I want you to make sure the nipples are in the right place where the, stuff like that. And then I went to him, we had the consultation. He brought me in. The one thing I hate, he was in a rush because he came in, he told me, sorry, I'm in a rush because his son or something didn't make the bus, like didn't get on the bus in time or something like that because an early delay started or something. So I was kind of mad that we were in a rush, but at the end of the day, everything got said. He answered every question perfectly. I love this doctor. Like, I'm glad I have him. He's amazing. We looked at the picture of him online. Oh my god, online he's like 20 years old. In person he's like 50. So that picture was definitely like 20 years old, like that picture was. So that was kind of funny. I was expecting a way younger guy, which I like older people because, first of all, they've had more experience since they're older and they've done it longer. Second of all, I feel like someone more my age, like he looked, in that picture, he looked like 20-something years old. And that's my age, I'm 21. So I feel like kind of cringy, like having a guy look at me and he's the same age as me, other than like an old person, like someone that could be my dad. The nurse came in and took my blood pressure. That wasn't going to be my nurse. I guess they say they all help each other out, which that's cool. That's not actually going to be the nurse that does the procedure with my doctor, but she came in right after because everywhere was kind of hectic. Everyone went in and out. He was in a rush, but he came in, he said everything. He's like, all right, so what we're gonna, and like the thing was, it was way different than I thought. I thought maybe I could make some decisions. No, I can't. So first of all, what surgery I'm gonna get double incision. Yeah, kind of knew that was gonna happen. He said like my chest size, like, they're like A to B right in the middle. I would say like they're small, and they pass. But the thing is, after you start testosterone, first of all, remember, I used to bind with duct tape. I used to bind with ace bandages. I also bind with a binder. Literally right when I was able to, like at a young age when my parents didn't support, I would literally use duct tape, and not just like that. I would use duct tape and go like this. Yeah, I know I'm dumb, but like that's what people do when you're needing to bind and your parents don't support you. That's what happens. And I made bad decisions back then. I feel like my chest is like, they're supposed to be like up here, I feel like, but they're like down, they're saggy. They're like man boobs now. And mostly that's with testosterone. Like, obviously when you're a female, you got like perky boobies, and then when you start testosterone and like manly and you bind, they're gonna be saggy. They're not gonna be perky anymore. And that's what he's talking about. He's like, so you could get peri, but they're, everything, it's going to have a little bit extra skin and all that because I'm saggy, and my nipple placement won't be in the right place. But the one thing I liked about him, he said, okay, so I'm going to do something. He's like, this is not going to be the same as a cancer patient because you're transgender, and we need to make your chest as masculine, as like cis as possible, and your nipple, your areolas are way too big. We need to cut them down. Your nipple, he literally grabbed mine, and I actually wasn't even, like, that's one thing I like about him. I heard you had to like put on a gown and like show yourself. No, he's like, well, are you binding or anything? I said, no, I'm not. Yeah, and I wear a button-down shirt so I could just unbutton. And he was gonna get one of those, and I'm like, no, I can literally just do it. Like, I'm not like that scared. Which is weird. I'm not that scared. I just literally was like, here, look at me. I don't care. And he grabbed my nipple. He's like, we're gonna have to take half your nipple off. And he like pinched it. I'm like, whoa! I didn't say anything because I'm just like you're pinching it. Like, it hurts. Like, I'm sensitive there. Obviously. So that was kind of awkward. Just because it hurt, I was like, ooh, like that hurts. But and I didn't have to say anything. Like, I actually wrote a lot of things on my notes in my phone, like what to say. He answered all of it. I didn't even have to say anything. I'm like, Okay, so yes, he did rush through everything, but at the end of the day, everything got said. It took 5 minutes. I took the whole day off too, so he didn't waste my time. I didn't waste his time, and then I got out of there and I got to hang around Des Moines all day, you know. So it all went good. I love the doctor. He took a picture of me shirtless and told me he's gonna send it to my healthcare, like insurance or whatever. And I said, no, I'm not going through insurance. He's like, oh, okay, you're paying out of pocket, okay. And then he said it is cheaper, and also a revision. He said free. He's like, usually revisions get paid by insurance. Since you don't have insurance, I gotcha. It's fine. So if you need a revision, he says, you shouldn't really need one, but you know, just in case something happens, because everyone makes mistakes. You know, if something you don't like happens, it's for free. So that's awesome. That actually made me happy. So it's like, okay, so if it doesn't turn out perfect the first time, which he says it's usually fine, but like some people are like really, really picky. So they're like, no, I don't like how you did that there. You need to redo it, you know, which I'm not that picky, you know, at least it's flat. I'm going to be fine. I probably won't need a revision, but I'm happy that it's free. I do not have a surgery date yet because they haven't even gave me how much it is. They did say not going through insurance actually cheaper, which I don't understand how it's cheaper. Maybe because I don't have to, because you have to pay for your insurance too, so maybe that's what they're talking about. I don't know. He did say it's cheaper, so maybe he's actually going to give me a good deal because he didn't give me it right now. And also he said I'm going to have 2 hours of anesthesia. So that means I think the surgery is only going to take 2 hours. So that's awesome. They're going to go over everything because they're all in rushes right now. They didn't tell me the exact price. They're going to go over everything, be like, okay, so 2 hours of anesthesia, that's going to cost $1,000. All right. You know, stuff like that. So double incision already, it's going to cost blah, blah, blah. The surgeon fee, blah, 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 you know. And they're going to send it, I think they text me or they're going to email me or something in the next week. So I got it Monday. So next coming Monday, I should get a text saying, hey, Clayton, it's going to be 10 grand. Will you want to pay it? And then I have to call back and be like, yes. And then they'll give me a date. Which they did say, right now they said it can happen in a month to 2 months. It just depends when you call. And, you know, just like my consultation was supposed to be on April 1st. I got it March 1st. So just think. And they also said, hey, like, you could get a surgery date, and they could say January, and then they could bump it all the way back to April. So just, you know, that's what they said. They said everything changed. People get their surgeries, and they cancel and stuff like that, you know. So, and then I can bump right up. So I am happy. I'm excited. Yes, I was a little sad at first because I really wanted Perry because I'm small enough to have Perry. It's just the sagginess, which could be my fault. So I do want to say, you guys, if you guys are binding, maybe stop binding if you're like as small as me, like an A cup to a B cup. If you can wear a shirt without binding and you can't really see that much, try not to. Like, try to just wear a shirt and not a binder, because maybe if I didn't duct tape when I was pre-T or ace bandage and do all the stuff I'm not supposed to, or wear my binder more than 8 hours a day, you know, maybe they wouldn't be as saggy as they are right now, and I could get Perry. But at the end of the day, I'm happy. I'm fine. I know double incision is the best because they take all the breast out. And also, the one thing I liked about him, he used correct pronouns, everything. He's like, all right, since you want the masculine chest, we're gonna take the. He didn't say breast, or he did say breast tissue because that's what it's called, you know. But he, like, masculine chest. He didn't say masculine breast and stuff like that. You know, he said the right terminology. He said, all right, we're not gonna do cancer patient because you're transgender. We want it to, you know, get the right stuff. Like, the areolas have to match like, he was amazing. I didn't even get to say anything. He just said all. I'm like, dang, that's everything I wanted. Like, I didn't have to say anything. He's like, you have any questions? I'm like, no, you answered it all. So he's a cool guy. I'm so happy to have him. I think they said a week to 2 weeks they'll send me the amount. So yeah, and I'm guessing if they're taking this long to tell me the amount, maybe they are gonna try to give me some kind of deal, like cut a deal out and take $1,000 off. I would totally love that if they do. Thank you guys for watching my videos. I really appreciate it. I'll see you guys next video. Bye.